How should I feel 15 weeks pregnant?
Probably thinking, wow, you mean I'm not even halfway there?
I know pregnancy lasts 40 weeks on average.
At least you're through the first trimester.
I know I feel better since the vomiting stopped.
That is one reason why the second trimester is considered the best. The vomiting and some of the swelling of the ankles stops. But you haven't yet swelled up huge enough to strain yourself waddling anywhere.
I'm barely showing.
It is normal to feel the pants getting tight at this point. And you might feel the baby move.
I've heard that could be anywhere between 10 and 20 weeks.
Every day that goes by, that little flutter you feel in your abdomen is more likely to be the baby. One day, it will be a really clear jab that you can't mistake for gas.
So I may feel the baby move.
It is normal to feel nervous about an amniotic fluid test.
I'm not planning on doing that.
It is done to identify genetic disorders, and many doctors recommend it.
I'm afraid of losing the baby because of it. And I'm more interested in a sonogram to see if it is a boy or a girl.
They often can't tell if it is a boy or a girl for a couple more weeks yet.
What else may I feel about now?
The hormones intended to boost blood flow for the fetus often cause extra congestion in the nose. It is even called rhinitis of pregnancy.
And I'm not allowed to take anything for congestion.
The growing blood flow and blood supply sometimes leads to nosebleeds during pregnancy.
That would be about the only type of bleeding during pregnancy not to worry about.
You may have gained a couple of pounds due to the baby, though it is likely in the bra area instead of equally distributed all over.
While the baby is about the size of a lemon.
It is common to feel heartburn, due to the child's increasing pressure on your stomach.
The solution to that is more meals but smaller.
And then there's the constipation if you don't drink more water, and less tea and soda.
I know pregnancy hormones cause digestion problems like more gas and constipation. The bad part is wondering if that little feeling in my gut is the baby, or last night's dinner.
Thinner women are more likely to feel motions earlier than heavier ones.
They also show sooner.
Whether you are showing or not, it is normal for your waist to start thickening as the uterus grows.
Along with everything else.
You may still feel soreness in your breasts as they grow, along with twinges from your tendons as they strain with the growing load.
The baby is small enough to fit in my hand.
True, but your body isn't used to carrying that mass, and the twinges and aches are going to grow with time. However, if you feel any sharp pains, talk to the doctor.
I feel like I'm going to get tired of seeing her by the time this is over.
No, you just switch from an obstetrician to a pediatrician.